What would you give to be less tied to your health insurance company? Dr. Timothy Wong, a Pittsburgh area physician, may have an idea for you. That's what we talk about on today's House Call. Hey everyone, welcome to House Call. I'm Dr. Rueben Brock. I am here at the iHealth clinic. I am with Dr. Timothy Wong, who created this new clinic that I think you should know about, where you have essentially abandoned the insurance companies. Mm-hmm. Is that right?
Yep.
So tell me about it.
So abandoning the health insurance is actually not a new idea in primary care. There's something called direct primary care, where a lot of providers are actually not taking insurance, but their financial model is based off of memberships.
Okay.
So say you are an individual or a family, you have to pay maybe $60 or $100 or $200 depending on your family size every month.
Okay.
But your visits are free or $5 copay or something like that. But my twist on that is I didn't like the membership model because it kind of creates an artificial insurance platform. Because if you're not using your membership, just like if you went to a gym and you're not going, you still have to pay your membership. And what happens is you're actually paying for someone else.
Right.
So kind of I had the idea of kind of direct primary care, not taking insurances, but I didn't like the idea of membership. I really wanted to change that model up and say, well, why don't I do this? Why don't I try to decrease the cost of delivering care as much as possible? And the only way to do that, it really is a micro practice model, where I am pretty much the only employee.
Okay.
I answer the phone calls, I do the IT, I sweep, I clean the toilet, I do the marketing, I do the website, and I am the doctor too. So I do the vitals, I have an iPad to do check-in, but that way I can actually decrease my overhead and pass those savings on to patients. And I don't need to have a membership model. So our model is most visits are actually only $35, which makes it much more accessible for people.
Right. So you're saying by cutting out all the extras that are normally embedded into the healthcare system, you're able to get the cost down.
Yes.
But a lot of that is dependent upon you, right? I mean, you're everything. You just said you're the janitor, you're everything.
I'm working less than I did as a traditional doctor because I reduced a lot of my administrative costs and time. So there's an article that says from the Annals of Internal Medicine that an hour of clinic time actually is equal to 2 hours of admin time.
Okay.
So every hour your doctor spends seeing patients, that can sometimes mean 2 hours of clinic time doing documentation, going through insurance paperwork, handling refills, test results, and all those. But at this point, I almost do none of that. And so I reduce my overhead.
Okay.
And not only that, I save money because I'm not billing insurance. It's estimated, I think I save about $120,000 a year by not billing insurance.
Doesn't this model mean less money for you? But you're saying maybe not.
So it matters how busy you want to be, and I think that's the great thing about it being in a small business is you can work harder, and if you feel like you're not working hard enough and you want to see more patients, in healthcare, the good thing about that is the sky's the limit. And the biggest thing you have to worry about is burnout.
Right, yes.
And taking away from your other personal and family life.
Right.
But if I hit about 20 patients a day and work maybe 5 days a week, I estimate that I'll make maybe 150.
Okay.
And average salary for a primary care doctor across the country is $220.
Okay.
And in Western PA, I would say it's maybe $180.
Okay.
So it's not
so
too
it's not
much
terribly
lower.
different. Okay.
No.
Okay.
And if I worked harder than that, I can, if I saw 50 patients, I could actually make double what an average family provider could make.
Okay. So you're saying for you, it wasn't as much of a sacrifice as it might sound like.
It is a sacrifice in the short term for sure.
Okay.
The first 2 months were open, I couldn't pay myself anything.
Yeah.
I was paying into the business constantly. This month in October, actually, I was able to pay myself, I think it was $2,000 this month,
Okay.
which is a huge improvement. But that's what it is with a small business. You know, you're not going to go to, you know, profitability on day one.
Right.
That's not possible.
Right. Well, but that does lead me to my next question, which is, what made you decide to do this?
I think it was a combination of things. I think, you know, just the absurdity of the healthcare system.
Right.
And there's a lot of examples. You know, one of the big examples is it's almost a cold war of administrative costs that's going on. So insurance companies want to decrease their costs. So they make more administrative burdens and more administrative rules to follow because that provides obstacles so that we can't get, you know, tests done or get prescriptions filled.
Right.
So we have to hire more staff to fight those rules and get patients what they need. But then they will decrease costs further by making more rules. We hire more staff. We charge the insurance company more because we need to hire more staff.
Right.
Now they have to reduce costs even further. So it becomes a cycle of we're going to make more rules while we have to hire more staff and charge more to cover the staff costs.
And so you saw all that and you said, this is ridiculous.
It is ridiculous.
It is.
You know, when a patient has to pay, you know, $150 just for a cold visit, that's not an efficient system.
Yeah.
That is not an efficient system. And it was weird that I was actually very insulated in my old job because I took insurance. I didn't realize how many patients had no insurance. And when I moved to this model, I would say over 50% of my patients now don't have insurance. And I'm like, was this exactly what it was before, but I just never saw these patients who actually really needed care?
Right. And because they don't have insurance, they can't come in. In their mind, they can't get help because there's no one that's going to pay for it.
Well, they can, but what they're doing is they're making economics decision. Is treating my depression worth $150 and then another $150 and then maybe the meds $50? So they're making that calculation.
Right.
And so by lowering that price point for them, you're making healthcare more accessible, and it's an easier decision where you don't have to decide, am I going to spend half my rent today on healthcare bills?
Right. And so you say it's $35, right? It's
most visits.
For most people. So you're saying $35 is a little bit easier for someone to stomach, and so they come in and they'll get their healthcare needs, which we should probably all agree is a good thing.
Yeah, I don't think anyone's going to argue that more access to primary care in the healthcare system that we have is a bad thing.
Right.
But it's really getting that price point from membership, from insurance, from 150 to 100 to, you know, something that's affordable. And if we can decrease the cost from 35 to 30 to 25, or if, you know, and you're in another state and you want to reproduce this model and you can do it on 20, well, good for you. You can do it on 20.
Right. And so a young doctor who's thinking about this, you're saying this is a viable solution, and I would imagine that you would love to see other people doing this.
I would definitely love it. So going back to your question of kind of what made me think of doing this is I really thought in systems.
Okay.
And it drove me nuts when a system didn't work.
Yeah.
And it was inefficient. And I think that's, I don't know, it's almost like my obsessive compulsiveness of just making a system better.
Okay.
And so, yeah, if I had a 1% chance of making the healthcare system better by introducing this new model, having another provider follow this model, you know, I would say my career has been worth it. And I purposely designed this model so that we don't take outside investment, we don't take donations, we don't take grants, so that it can be reproducible. Whether you're in Kansas, Hawaii, California, eventually I'm gonna write a white paper and show exactly how I did it, so that it can be reproducible.
So that other people can do this in other cities.
Yes. Exactly. Yep. We're actually going to call it direct access primary care. That's what I kind of coined the term to differentiate it from direct primary care that has memberships.
Yeah.
Because this model really promotes access by lowering costs and allowing patients to get their care.
You're taking out all middlemen. You're saying come directly to, you're going to get your health care here.
Yep.
Wow. Okay. And so what person out there should be saying, I need to go to the iHealth clinic?
So it's definitely open to anyone,
Okay.
all ages. The youngest patient I saw here was a day old.
Wow.
And so it's really up to you.
Okay.
Financially, though, it makes most sense if you have a commercial insurance because you have to factor in your copay, but also your deductible. And so your copay might be $0, but if you haven't met your deductible for the year, and most people will never meet their deductible, you're going to pay full price.
You're paying out of pocket anyway.
Exactly. So you might be paying $100, $150 for your doctor visit, and you don't realize it at the time because you get billed later. So economically, people with commercial insurance definitely make sense.
Okay.
Those who want to go to primary care or urgent care, and those who don't have insurance because, like we talked about, if it's $150 or $100, the only other options are free clinics around the city, and it's not a financially sustainable model, but it's difficult to get into free clinics.
So how has the community responded?
It's actually been surreal. As a primary care doctor, I think we're undervalued in society because we're not a specialist.
Yeah.
But we're also the front line, and we do we're the primary team.
Right.
But coming to this model, actually promoting access and reducing the costs, patients have been so grateful that I've never experienced before. It's been almost remarkable where patients are just so grateful to have a service that you're willing to provide, but knocking down those barriers so that they can get access.
Right.
So if I've had people walk in and just say, "Hey, I'm feeling fine. I'm not here for a visit, but I just want to thank you for what you're doing."
Wow.
Yeah. I've had patients call and say like, "Hey, can I donate?" And I'm like, "Well, sorry, we don't take donations, but thank you so much."
Yeah.
We've gotten a lot of social media support.
Okay.
It's been phenomenal how grateful and how valued I feel, but how much support the clinic's gotten. The social support has been outstanding.
Yeah. So tell everybody how they find you, how they, because there are going to be people who want to say, where is this place? I want to check it out.
Sure. I guess the first place to go is you can just do a Google search for iHealth Clinic. That would be the easiest way. Our website's www.ihealth.clinic.
Okay.
Yeah.
Easy enough. Okay. So, being a healthcare professional, I cannot express how revolutionary this is. Essentially, we are trained to sort of depend on health insurance. And so getting away from the health insurance system allows the clinician to make all the decisions. It also, like he says, takes away barriers to healthcare, which in my opinion is a really, really important thing. So I appreciate what you're doing. If you are in the Pittsburgh area, consider coming out here and checking out the iHealth Clinic. If you are a clinician in another town, look him up. This is a really, really cool idea. I like it. I wanted to make sure that you guys got to see it. So if you want to know more, feel free to send me a message on Facebook, on YouTube. We're always happy to answer your questions, and we will direct you to Dr. Wong if you need to know anything about this. Don't forget to leave us a like, subscribe to the channel so you know that new episodes are coming out. Thank you to Dr. Wong for being here.
Thank you.
All right. That's all we've got for today. I'm Dr. Brock. This is House Call.